Welcome back to Black News Tonight. A black celebrity who has already received the Johnson & Johnson COVID vaccine now has the virus. The comedian, actor Chris Rock, last night tweeted that he has COVID. He said, and I quote, "Trust me, you don't want this. Get vaccinated." A new CDC study agrees with Chris Rock. They say from their data, or based on data collected from 13 states for the first 6 months of this year, a vast majority of the hospitalizations, at almost 90%, comes from unvaccinated adults, whereas that number is only 4% for adults who are fully vaccinated. And among vaccinated adults like Chris Rock, who have had a breakthrough case, the median age for hospitalization is 73, and almost 3/4 of them all had 3 or more underlying conditions like diabetes, heart disease, or autoimmune conditions. According to Johns Hopkins Coronavirus Resource Center, as of today, more than 675,000 people in the United States have died from COVID. That's roughly equal to the amount of deaths from the Spanish flu of 1918 and 1919. And currently, 55% of Americans are fully vaccinated. But there are still people in our community and around the country who do not agree with the CDC data. One of those people is the researcher and member of the Nation of Islam, our brother Rizza Islam, who is joining me now to have a conversation, which we promised we would have. We've been trying to get the scheduling right. I also have with me pulmonary and critical care physician, Dr. Cedric Jamie Rutland, on the show to offer a counter perspective. Rizza, I want to start with you. Why don't you trust the CDC data?
Well, first of all, the CDC actually within itself doesn't trust its own data. There are whistleblowers inside of the CDC who have countered these numbers, arguments, and the overall data as it pertains to the deaths, as it pertains to those who have transmitted the virus, as it pertains to those who have contracted the virus. The CDC early, I believe, or mid last year in 2020, it was admitted that the tests, for example, were contaminated. A large percentage of those that were sent to roughly 100 laboratories all throughout the United States were admittedly contaminated. So from the very beginning, the people dealing with the recording of the numbers and those tracking who was positive or negative was already contaminated to begin with. And due to an internal investigation between the CDC, HHS, and FDA, they are still investigating, trying to see exactly what is accurate and who is it that is behind this. So the CDC itself is not accurate, and they have already admitted that those numbers are skewed.
Jamie?
You know, I listen to the CDC. I read all the papers that Rizza has read. I respect his efforts in reading all these papers. I think that's tremendously important. But at the same time, I also have experience in the hospital, experience in the ICU. I literally just left the bedside of a COVID-19 patient who's been in the hospital for a month, who's now on 100% oxygen. So I agree with the data because that's what my experience is showing me. And that's what I see in the hospital as I walk those hospital hallways on a daily basis.
Rizza, let's say for a minute that the data is off. Let me concede that point. I don't think that that's the case. I don't know enough to have an opinion on it, but I'm saying if that were the case, your skepticism of the CDC isn't based on that. Prior to that information that you're mentioning, you still didn't trust the CDC data. Talk to us about why.
Well, the CDC, and just so we can be very clear about this circumstance, COVID is the recent circumstance that I've not only been researching, investigating, so that we can all have a full informed consent, as our brothers of pulmonology will definitely agree with me on. People should have the full informed consent, meaning all of the data. We should be given the full benefits as well as the detriments. We should be given the alternatives, including the nutritionist route, including the herbalist route, including any other route, not just being told to take the shot. That is not true informed consent. And every medical professional, as our brother just said with experience, he knows very well that informed consent is something that every patient should be given, and they have not been given that generally. Maybe he has done that, which would be beautiful if he did. But for general, the population has not been given informed consent. The CDC information I've been researching has been done roughly over the 6.5 to 7 years, going all the way back to the MMR circumstance, the measles, mumps, and rubella circumstance, where Dr. William Thompson, the senior lead scientist over the Center for Disease Control's Vaccine Division, quoted or stated, quote, "If we would have admitted this information at least 10 years earlier, this in 2014, we could have prevented at least 100,000 Black boys from having autism." And so from that point in 2015, I've been dealing with vaccines as an overall topic. Although I do not have a degree, I have experience with tens of thousands of parents dealing with their children, dealing with their families, their elders, and them as well. So we may not have experience in the hospital physically in that building, but this whole city and circumstance and country has become a hospital. And so wherever you see the person suffering, that is where we are there to help them. And I've had a lot of experience in that end.
I just want to interject on the last point. All the relevant and available scientific data has disputed the idea that there is a correlation between vaccines and autism. And unless there is some other data, I mean, do you know of a study that demonstrates that relationship?
Correct. There are over, let's say, for example, there are roughly 400 at minimum. There's a book titled Miller's 400, also known as Miller's Review, that was produced by Neil Z. Miller, who was a physician who got tired of people lying, saying that there is no connection between autism and vaccines. That is an absolute lie. It is an emphatic lie. And people in the medical field who have studied this know, and those who have been heavily indoctrinated for some reason do not want to
I understand your point, but I'm saying, I'm only talking about studies, though. All the available research shows that there is no correlation. All scientists have corroborated that. I understand there are books who may make a counterpoint, but there's a difference between a book and an actual empirical study. So I want to pivot just so we keep going, but I want to give you the opportunity. Say it again.
Those are empirical studies that were placed in the book. The studies that are made available are the ones that are sponsored pharmaceutically, that are only being pushed to launch.
Okay.
The ones that are not available are the ones that they are hiding, which they have absolutely done.
Okay. I want to move on. Again, we're going to disagree on that point, but I don't want to get away from the COVID thing. So, and we can always come back and continue to do this. In fact, we'll make sure that this conversation stays an extra block so that we can have a full conversation, because I don't want to cut either of you short. Jamie, some argue if you get COVID, then your immunity is stronger than the immunity that the vaccine provides. That's one of the major arguments people have against taking the vaccine, is that natural immunity would be stronger. Is that true?
You know, there are several things that people have to understand about COVID in general. And I think that there are misnomers that are populated on a daily basis all over the place. The first misnomer is you're positive for COVID. No one is positive for COVID. SARS-CoV-2 is the infection. That's the virus. The disease is called COVID-19. That's what we have to understand first and foremost. Once you're infected with SARS-CoV-2, the virus, which is an RNA virus that consists of many different types of proteins. We're going to talk about the proteins that are on the outside of the virus. One's called spike, membranous, envelope, and nucleocapsid protein. Once you're infected by that virus, when it enters your body and it binds to your epithelial cells, or the cells that line the inside of your lung and your airway, your immune system becomes activated. And once your immune system is activated, it recruits white blood cells to the area where the virus is most present. When that happens, that's when disease can possibly start. If too many white blood cells get recruited in your lung gets congested. It can't do its job anymore. You cough, you become short of breath, you develop pneumonia. If too many white blood cells end up in your intestine, an area where the virus also likes to infect, you're going to have loose stool. You're going to have abdominal pain. And so that's the first order of business. Now, when you think about this term natural immunity, what that essentially means is you're exposed to the virus. Your white blood cells take a look at this virus, they cut it up and break it up into little pieces. They display these little pieces to other white blood cells to make antibodies, to make T cells, to make B cells and dendritic cells, all cells which manufacture molecules to help neutralize the virus. And then within about 7 to 14 days, once all of those molecules are around your body doing what they're supposed to do, you get better. Unfortunately, with SARS-CoV-2 and the activation of the inflammatory response, it can be very, very severe, and your lung becomes heavily congested. And when it becomes heavily congested, that's when we have to support people with oxygen. Now, when you look at immunity, and immunity right now is measured as antibody levels. So the higher the antibody level, we say the more immune you are to a disease, which again, isn't exactly 100% true. But when you compare natural infection to vaccine-induced immunity, natural infection is probably just as good. And there was a paper that was published last night, preprint, that shows that the antibodies stay around for longer and they're around. And so What that means to me is if one of my patients who's hesitant about getting the vaccine, if they have already been infected, and I usually use 6 to 8 months, within 6 to 8 months, because I want them to have that Delta variant, I'm not going to scream and yell and tell them to go get vaccinated and go get vaccinated. I'm going to say, listen, you were lucky, your protoplasm was great, you got through it, you're feeling fine. I'm not going to scream at you for the vaccination. But I still encourage others to get vaccinated because what vaccines actually do is they give the body a piece of the virus. In this case, the spike protein. The body recognizes it, slices it up into little pieces, and it displays these pieces to the white blood cells to be able to manufacture antibodies and other molecules that recognize when the virus is actually in your body. That's the point of a vaccine. It's kind of like scouting a basketball game. If you want to play hoop and you're playing 1-on-1 or you're playing 5-on-5, you want to go scout that team you're playing. You're going to send a scout to go take a look. Does this guy like to go
And
left?
that's what the
Who likes
vaccine.
to
I
shoot
got
threes?
you. Jamie, let me
That's what
pause
the
you for a
vaccine
second.
does.
We got to take a break, but what I'm going to do is we're going to take a break, but we're going to come back. I want to continue this conversation with you too. It's an important conversation I want to continue to have. Both of you stay here. Everybody, we'll be right back with more Black News Tonight. Welcome back to Black News Tonight. I'm back with pulmonary and critical care physician, Dr. Jamie Rutland. I'm also back with Rizza Islam. We're talking about COVID vaccine. Brothers, I have about 4 minutes, just pacing because I know all of us can move with the talking. Rizza, let me start with you. There's some fundamental claims here that doctors have made, and that is that for those who don't have antibodies, if you have COVID, if you get the vaccine, it makes you less likely to get COVID. If you get COVID, it makes you less likely to die from it. We know that people who are disproportionately vulnerable, whether it's because of high blood pressure, diabetes, etc., Black people are disproportionately in those categories. And so the vaccine makes you less likely to die and makes you less likely to get sick. That's the claim that's being made here. Do you disagree with that claim?
We only operate along actual facts, so the claim in itself is not factual. The former director of the CDC stated that early on, the evidence and the data was to show and was to purport that the vaccines would prevent hospitalization and prevent death. That was the intent. It was never intended to prevent the contracting of the virus or the spreading of the virus. Later on, you see the 17th of this month, they just had the meeting. The FDA actually had meeting with biological products and vaccines. And they just did that virtually. It was roughly an 8-hour meeting by where multiple doctors, chemists, scientists did their presentations on their new updated findings. There was a doctor by the name of Joseph Freeman, who was an emergency medical physician from Cornell, who stated that not only is that data no longer the case, but one, the people who came into his clinic, along with most of his nurses who take care of these people, those who did not take the shot, one, were healthier, two, were far more educated about the studies, three, are the people who actually knew far more about it than those who were vaccinated. That's one major point. Another thing is, brother, the pulmonologist who just spoke, dealing with natural immunity versus vaccine-induced immunity, he did state beautifully the immunoresponse, and he also stated beautifully how the vaccine-induced side of it is only giving you a spike protein, which is a part of the virus. Here's the beauty of it. When you get the actual virus in the wild, you're getting the full virus. So rather than you taking one class, you're getting all the classes. The body is now given all of the information about this virus. Then it can have a full response, building up the full antibodies, white blood cells, etc., so that if you come into contact with the virus later on, you will have a higher likelihood of fighting it off. And to validate that point, Dr. Rochelle Walensky, the director of the CDC, stated that those who took the shots early on from December up until now have a higher likelihood of getting sick and have a higher likelihood of not being protected from the new variants, while those who did not take the shots but who did contract the virus in the wild have a higher likelihood of fighting it off and have a higher likelihood of fighting off any other new variants because they have an increased natural, also known as innate, also known as God-given immunity.
A couple quick things. So with all due respect, you didn't answer my actual question though, which was I laid out a set of claims and asked, are they true? And your response was that those weren't the original claims or intentions of the vaccine. That's not in dispute for me. I'm not disagreeing with you on that one way or the other. My only question was whether or not the vaccine will make you less likely, et cetera, et cetera. So just to be clear. And as far as just a point of fact for that FDA meeting, because for some it's been presented as a sort of a group of FDA advisors or a group of FDA people. That meeting was an open meeting to the public that some people weighed in on. Some people, those claims haven't been vetted, they haven't been verified. So we would have to subject those claims to the same scrutiny that we would anybody's claims. Again, I'm not saying they're wrong, I'm not saying they're right. I'm simply saying I want to make sure we represent who the participants in that 8-hour public meeting were. Jamie, I want to give you a chance to respond, and that'll have to be the last word because they wanted me to wrap this 5 minutes ago, but I'm like, we going to have this conversation because it's so important to our people. Jamie, go ahead.
First of all, Rizza, I'm impressed with your immunology knowledge, and I really appreciate you looking into all that. Second of all, when you are looking at the immunology of this, when your body is exposed to the natural virus, your immune system can be that much more activated because it has to deal with the entire virus. And it has no base or foundation of which to deal with. We know that the spike protein is probably the most important protein because that's the one that latches onto our cells. That's why the vaccination is necessary. You are correct. In people who had SARS-CoV-2 infection, they do have a more diversified response as it pertains to variants. But in people who have SARS-CoV-2 infection plus the vaccine, their response is even more diverse, and that hybrid immunity is king, so to speak. But again, Rizza's making good points about natural immunity, but the vaccination claims that he made in which the vaccination is ineffective is completely untrue. In my ICU right now, all the patients in my ICU who have SARS-CoV-2 infection and severe COVID-19 are unvaccinated. That is a fact, okay? That is not a made-up number. That is what I see every day. I would challenge him, and he is welcome to come with me and round if they let him in, and he can see what I am seeing and really truly understand the severity of this pandemic on these people who do have risk factors, but they're still people and they're still suffering.
All right, yeah, we're going to keep this conversation going. Hope
we have another conversation. There's a whole lot of data.
I gotta go, brother. I gotta go. I gotta stay employed. And no, this ain't no conspiracy. Not because it's about COVID, y'all, because we got commercials, because it's TV. Y'all can both come back and we can keep the conversation going. Just it could be tomorrow. It just can't be right now. Everybody, thank you so much for your conversation and for your talking points and your thoughtful responses to each other.